Healthcare access and affordability issues in Texas. Uninsured population. Texas has one of the highest uninsured rates in the United States, with millions of residents lacking access to health insurance coverage. This limits their ability to afford necessary medical care and preventive services. Rural healthcare deserts. Many rural areas in Texas lack adequate healthcare infrastructure, including hospitals, clinics, and primary care providers. Residents in these areas face challenges accessing timely and quality healthcare services. Limited Medicaid expansion. Texas has opted not to expand Medicaid eligibility under the Affordable Care Act, leaving many low-income adults ineligible for coverage. This leaves a significant gap in coverage for individuals who do not qualify for Medicaid but cannot afford private insurance. High healthcare costs. Healthcare costs in Texas, including premiums, deductibles, and out-of-pocket expenses, can be prohibitively high for many residents, particularly those with chronic conditions or low incomes. Barriers to mental health services. Access to mental health services in Texas is limited, with shortages of mental health providers and a lack of funding for mental health programs. This contributes to disparities in mental health outcomes and exacerbates issues such as substance abuse and suicide. Health disparities. Minority populations in Texas, including Black, Hispanic, and Indigenous communities, experience higher rates of uninsurance, poor health outcomes, and limited access to healthcare services compared to white residents. Addressing healthcare access and affordability in Texas. Expand Medicaid eligibility. Advocate for the expansion of Medicaid eligibility in Texas to provide coverage for low-income adults who currently fall into the coverage gap. Invest in telehealth. Expand access to telehealth services, particularly in rural and underserved areas, to increase access to healthcare providers and improve continuity of care. Increase funding for community health centers. Allocate funding to support community health centers and safety net clinics that provide essential primary and preventive care services to uninsured and underserved populations. Address healthcare workforce shortages. Implement strategies to address healthcare workforce shortages, including incentives for providers to practice in underserved areas and increased funding for medical education and training programs. Improve mental health services. Invest in mental health services and programs, including increased funding for mental health providers, expanded access to crisis intervention services, and integration of mental health care into primary care settings. Promote health equity. Prioritize policies and programs aimed at reducing health disparities and addressing social determinants of health, such as poverty, education, and housing, to improve health outcomes for all Texans. By addressing healthcare access and affordability issues in Texas through policy changes, increased funding, and targeted interventions, policymakers and stakeholders can work towards ensuring that all Texans have access to affordable, high-quality healthcare services.